Here we talk about orthostatic intolerance syndrome. It's another primary autonomic function abnormality. Okay, what goes on here is hypotension related to body position. So when a person changes the position from a sitting to a standing position, for example, then there is a drop in blood pressure, hypertension. Okay, so what could be causing this is where you can think about hypovolemia as one cause, not drinking enough water, losing water in different forms. All of those are possible. Or sensitivity to beta 1 receptor or venous pooling in the lower extremities, like standing in one position for a length of time, okay, venous pooling in your legs, and then that leads to hypotension. Denervation of sympathetic nerves in the lower extremity could also be another cause. Okay, how would the patient feel in this condition is where it's a compensatory mechanism, palpitations to increase the heart rate, to increase blood volume in circulation, tremulousness, lightheadedness, syncope, that is fainting, and fatigue. How do we help this patient? Well, increase the intake of fluid, or if you wanted to use a medication, that's where you would talk about alpha-1 adrenergic agonist. This is common in young women specifically. All right, so that's about orthostatic intolerance syndrome. Thank you.